Heavy metal poisoning is a serious health concern that often goes unnoticed. It's a condition that can sneak up on us, causing damage before we even realize there's a problem. Heavy metals like lead and mercury can accumulate in our bodies beyond safe levels, causing a range of health issues. The challenge with heavy metal poisoning is that its symptoms can mimic many other conditions, making diagnosis tricky. Headaches, fatigue, and digestive issues might be brushed off as stress or a minor illness, but they could be signs of something more serious. By understanding the causes and symptoms, we can better protect ourselves and our loved ones. In this essay, we'll explore the main causes of heavy metal poisoning. We'll look at common sources in our environment and daily lives. We'll also discuss the symptoms, both acute and chronic. Finally, we'll cover some practical prevention tips. My goal is to empower you with knowledge to safeguard your health against this silent threat.
Chronic heavy metal poisoning, the slow burn. Chronic heavy metal poisoning occurs when someone is exposed to small amounts of heavy metals over a long period. The symptoms develop gradually, often over months or years, making chronic poisoning difficult to diagnose. Fatigue, cognitive symptoms like memory problems, and mood changes are common. Physical symptoms can include headaches, joint and muscle pain, and gastrointestinal issues. Skin problems, including rashes or discoloration, can occur. In cases of chronic arsenic exposure, patients may develop distinctive patterns on their skin or nails. It's important to note that the specific symptoms can vary depending on the type of metal involved and the individual's overall health. Patients may not connect their symptoms to environmental exposure. In my experience, many cases of chronic poisoning are initially misdiagnosed as other conditions. One of the hallmarks of chronic heavy metal poisoning is fatigue. This persistent tiredness can significantly impact quality of life and productivity.
Recognizing symptoms, when to seek help. Recognizing the symptoms of heavy metal poisoning is crucial for early intervention. Persistent, unexplained health issues may warrant considering heavy metal exposure. Key symptoms include persistent fatigue, headaches, and digestive issues. Cognitive symptoms like memory problems or mood changes should also raise red flags. In children, watch for developmental delays or behavioral changes. Unusual combinations of symptoms, such as neurological symptoms paired with digestive issues, could point to heavy metal poisoning. Skin changes, especially in combination with other symptoms, are another potential indicator. If you suspect acute poisoning, seek emergency care immediately. For chronic concerns, consider seeing a practitioner experienced in environmental medicine. Early detection and treatment can significantly improve outcomes in cases of heavy metal poisoning.
Prevention safeguarding against heavy metal toxicity. Preventing heavy metal poisoning is far easier than treating it. Be aware of potential sources in your environment. If you live in an older home, consider having your water tested for lead. Use a high-quality water filter certified to remove heavy metals. Diet plays a crucial role in prevention. Eat a varied diet rich in antioxidants and foods high in sulfur. Be mindful of your fish consumption, especially if you're pregnant or breastfeeding. In the workplace, follow all safety guidelines and use proper protective equipment. Be cautious with products you use daily, choosing natural, non-toxic alternatives. If you have hobbies that involve potential exposure, take proper precautions. Prevention is about awareness and making informed choices. By taking these steps, you can significantly reduce your risk of heavy metal poisoning and protect your long-term health.